Well, we've been talking so far this week, here we are on Wednesday, about this hepatitis outbreak. And right across the world, health officials are investigating this. It's a worrying spike in cases, not too large here in Britain, but as you point out, Isabel, growing.
Well, yeah, I mean, they said in the last 3 weeks more cases than they would expect in a whole year amongst children, so very alarming for parents. The UK Health Security Agency reporting the number of known cases among children under 10 has now risen to, I was reading, around 200, and those who've needed a liver transplant has increased to 10. Well,
joining us now, Dr. Frankie Jackson-Spence with all of this. And Dr. Spence, why is this happening? Let's just get into this. What is hepatitis? What does it do? How do you get it?
So hepatitis is just a fancy term for inflammation of the liver. So it's when your liver is a bit aggravated. Now, why is this happening? That's a really interesting question, and health officials still don't know the answer. So the exact cause is unknown, but it is under investigation. Now, the speculation is that it may be linked to a specific strain of adenovirus, which is just a common virus that's commonly seen in children, particularly in the under 5s. But it usually causes cold-like symptoms or vomiting and diarrhea. But in these cases, some children have gone on to develop signs and symptoms of hepatitis, so it's potentially linked to that.
OK, so look, the worrying thing, of course, in all of this is that the symptoms are very common. You know, for any parent, they'll know that if your child's got a tummy ache or if they've got diarrhea or vomiting, it's just a normal week in a household for an under 5s. And that's the problem. A lot of these cases are getting missed, really, until it gets much too serious. So what should parents be doing if they are at all worried?
Exactly. So, as I mentioned, it may be triggered by a common cold. So symptoms of that, coryzal symptoms, or symptoms of gastroenteritis, vomiting and diarrhea. But when it leads to hepatitis, that has some more specific symptoms that I think parents and guardians should be alert for. So things like jaundice, which is yellowing of the skin, yellowing of the whites of the eyes, itching of the skin, tummy pain, particularly on the right-hand side, but also dark urine and pale-coloured stools. They're a little bit more specific for hepatitis.
Yeah. So, once you get hepatitis, and I was saying, we'll get people saying today, well, there's only 200 cases of it in the country. What are we worried about this for? That suggests to me we're worried because it's obviously very, very serious once you get admitted to hospital. So, what's the danger? What happens? What's the treatment?
So, I think the concern is that, first of all, I want to say that most children who are developing hepatitis are recovering well, and it's self-limiting, and the treatment is supportive with monitoring and fluids and supportive treatments. But there has been a small number of cases that some children have required a liver transplant, and that's what the concern is. Now, parents can't do anything to prevent this, apart from the usual hygiene habits that we've picked up, particularly over the last couple of years, regular hand washing, respiratory hygiene, covering your mouth when you cough. And if your children is developing any signs of adenovirus, so diarrhea and vomiting, stay home from school or nursery for 48 hours until those symptoms have resolved. And if your child is developing any signs of hepatitis, to seek urgent medical attention.
I suppose the tragedy in all of this is these little ones are the least affected by COVID, affected, of course, by the lockdown restrictions, and now, as a consequence of that, suffering this horrible outcome. Can you have a long, healthy life if you have a liver transplant?
Absolutely. So many patients who undergo liver transplantation will live a normal, healthy life, probably with a little bit closer health monitoring. But like I mentioned, I just want to reiterate that most children who are getting this hepatitis are recovering normally without the need for a transplant. It's very small numbers.